Dr. Tariq Pereira is a board psychiatrist with an office in Greenwich. Contemporary Care is a full-service psychiatric practice, and he says this office has performed the most TMS therapy treatments in the country.
TMS is where you get a magnetic coil, you put it over your head, and you create a pulse that directly targets the part of the brain that is underactive.
No pain. It literally feels like a finger, like someone's finger is just like tapping you on the head.
Pereira says TMS, or transcranial magnetic stimulation treatment, has been approved by the FDA since 2008, and it is safer to use than a cell phone. During the first appointment, the patient is assessed and then returns 5 days a week for 6 weeks for the treatment. Nerves in the brain are activated by TMS, and eventually the activation becomes permanent, says Pereira.
It works very fast, so people who've been depressed 10, 20 years start feeling better in about 3 weeks and get completely better in about 6 weeks.
Patients who have tried 4 antidepressants with no improvement to their mental state can be approved by most insurances, according to Pereira, who has done research on TMS at Columbia University and is the founding president of the TMS Society. He says about 70% of his patients get well after 1 6-week TMS treatment.
Our goal is to get them to have normal functioning. It's not about making people artificially happy. That's, getting someone high. Where we feel like if you are able to have normal moods and respond appropriately to what's going on and have normal functioning, normal levels of motivation, that is what we call wellness, and that's our goal. And we get there a lot better and a lot quicker and a lot more safer with TMS than with medications.
Pereira says this treatment can also be helpful to patients who don't want to use medication, like Camry DeCrosta. She was treated at Contemporary Care for anxiety and depression.
Part of my anxiety was health anxiety, so that made me anxious to take pills. So yeah, I like this because there's no side effects, and pills can give you a million side effects.
But for patients who do use medication, Pereira says they will continue taking them through TMS treatment. And he says TMS is essentially safe for every person to try, except for those with magnetic metal in their head.
The number of times people who have gotten better with TMS and tell me, look, if I didn't get better with this, I would have killed myself, is really scary.
Pereira says TMS can also be used to treat PTSD, OCD, and bipolar depression, but the FDA still needs to approve it for these practices. You can learn more at www.contemporarycare.net. Reporting for the Greenwich Sentinel, I'm Taylor Knight.